Welcome to the Let's Talk Kids Health Facebook Live Show, episode 45. I'm Dr. Narissa Bauer, your host. I'm a behavioral pediatrician and CEO of Let's Talk Kids Health. As you know, the concept of this show is to share information about behavioral health, parenting, and family wellness. Each week, I plan to bring you topics and guests to help me advance this mission so that we can all talk together. Now, let us know that you're here by commenting, asking questions, and liking this episode at any time. And as this episode was pre-recorded, we'll be keeping an eye on the chat box and responding at a later time. Now, the replay will be immediately available after the broadcast. So if you're watching this, then think of somebody who might benefit. Please share because sharing is caring. And if you don't want to miss future episodes or maybe check out some of my past ones, please consider subscribing to my YouTube channel, Narissa Bauer MD, and follow my blog Facebook page, Let's Talk Kids Health. All right, now on to this week's guest. I am so delighted to introduce you to Dr. Sarah Honaker. She's a clinical psychologist and pediatric sleep researcher. She directs the behavioral sleep medicine program at Riley Children's Hospital in Indianapolis and is the director for Healthy Sleep for Kids research program at the Indiana University School of Medicine. Sarah lives with her husband and her daughters, Kate and Bella, in Indianapolis. Thank you so much for coming on to the show today and sharing some of your time.
Thank you for having me.
I'm so excited to get to reconnect with you. Those of you who've been following me, as you know, I used to work at Riley and at Indiana University School of Medicine, and have had the fortune to work with Sarah, both professionally and then out of work, with our kids and all their interests. So it's been so fun for us to just kind of have this time today to chat. Today I wanted to really specifically call on you because of what the work you do. And as a behavioral pediatrician, I see so many kids with, sleep disorders and behavior issues. And I thought, you know what, why don't we bring on one of the best people that I know, calling a friend, and helping families who are struggling with this, kind of just get some firsthand advice. Now, I do want to qualify that anything that we talk about today, please always talk about this information with your child's pediatrician and or rest of the medical team. This is educational only. All right. So that being said, I thought maybe we just, talk about your experience. First of all, how did you get into this field? What made you interested? And then we can kind of go into everything else.
Yeah. So I think as much of life goes, there was a lot of sort of serendipity and random paths that got me to this point. But essentially, I was living in Louisville, and there were two postdoctoral opportunities that were available, structured at the time that I was looking for a postdoc, and one of them was in sleep. So I had the fortune of studying with David Gazal, who's an obstructive see in children, really an international expert in that topic. And I did some work in his fellowship, and then started the behavioral sleep clinic, or started seeing patients through the behavioral sleep clinic at the University of Louisville, and then came to Indiana University about 6 years ago.
Yeah, gosh, 6 years ago, time flies. A few weeks ago, I had a guest, Dr. Brown, come and talk about sleep apnea in kids. And I know there's always lots of questions about the role that sleep apnea has, especially in conjunction with behavior problems. Might we kind of unpack that a little bit and start there?
Yes, absolutely. So with sleep apnea specifically, it presents in about 2 to 4% of kids overall. And sleep apnea causes essentially obstruction in breathing when children sleep. So a lot of these kids will breathe fine when they're awake, but when they're asleep, they experience obstruction or collapsing or blockage in the airway. And so the child is trying to sleep, but the air isn't really getting through. And so two things happen as a result of this that can cause daytime issues for kids. So one thing that can happen is that the brain is not getting enough oxygen during sleep. And so that's never a good thing. But then the other thing that happens is the child is having multiple mini awakenings all throughout the night because their brain detects that they don't have enough oxygen in the blood, and the brain wakes the child so that they can breathe normally and restore their oxygen levels. But the result is that they're just getting very poor quality sleep, oftentimes not able to get into or stay into deeper sleep. And this can lead to some daytime behavior difficulties, so hyperactivity, mood issues, in some kids, sleepiness, although it doesn't always present that way. Sometimes children with sleep apnea don't appear sleepy at all during the day, but can appear, very hyperactive, and it can also cause learning issues as well.
Yeah. So, I mean, I think that's exactly kind of that area, that gray zone, where as a behavioral pediatrician, I see a lot of kids with ADHD. But one of the things that, we're trained to do is inquire about sleep habits, sleep apnea, and all of that. And so thank you for mentioning that. So that should always be on parents' radar. And that's why if a pediatrician asks you about snoring and sleep quality, this is why, so we don't want to necessarily jump to conclusions and, just say, oh, it's ADHD. We've got to do our due diligence and sort of sort through any underlying medical issues that can be complicating the presentation.
Yeah.
Yeah. And so kind of related to that, thank you for that, is like thinking about, you know, the effect of just general sleep quality on kids' mood. You had said that there, and I know you see so many kids in your sleep clinic. Do you want to maybe run through, like, if I were to just throw out an age group, kind of talk about maybe what some of your common issues are that you see,
Yeah.
and just provide just general education in terms of that, and any tips or pointers for sleepy parents.
Yeah.
So maybe we'll start with infants. What are maybe your top one or two things that you see when it comes to infants, and any take-home points?
Yeah. So, one of the most common issues that parents of infants face is night wakings. And of course, when the babies are really young, this is to be expected, and it's usually nutritionally driven. So babies need to wake to eat because their stomachs are small, and they sort of need that nutrition throughout the night. As they hit around 6 months, though, typically they can go quite a bit longer without needing to eat. And so what can happen then is that some of these night wakings are no longer nutritionally driven, but more habit driven. And I think your speaker a few weeks ago talked about the issue of sleep association. So this idea that if infants fall asleep being rocked or soothed by a parent, then oftentimes when they wake during the night, they're going to struggle to return to sleep without that association of nursing or rocking. And, at this point, there's not a lot of strong evidence to suggest that if infants are still waking up a lot during the night and parents are just tending to them and are rocking them throughout the night or feeding them throughout the night, it's not necessarily going to cause problems down the road. So that is a choice as well. But for those parents who are struggling and don't want to wake up 2 or 3 times a night to attend to an older infant, there are some behavioral sleep intervention approaches, sometimes called sleep training as well.
Yeah.
So.
Yeah, I remember getting a lot of questions like, when I used to see all comers in my behavior clinic at Riley, about like, what is the best way? I mean, there's so many parenting books out there. I mean, there's information overload, honestly.
Yeah.
And so many parents are so confused, like, which is the best approach? Is there a best approach? Like, how would you counsel, first-time parents who are like interested in sleep training, but not quite sure, like, which approach is best?
Yeah. I mean, I think there's a spectrum of approaches, and I think it's really a matter of sort of personal or family decisions and values. And so, at the most extreme end, you have what we call unmodified extinction, where a parent will simply put a baby in the crib awake, and the infant will cry themselves to sleep, and then and then if they wake during the night, subsequently the parent doesn't intervene, but has the baby just cry themselves back to sleep, and then goes in the morning. And to some parents, that doesn't feel like an option that's aligned with their values, and that's fine. The research suggests that it works, and it works quickly. It works in about 3 days, but it's only one option, and I don't think parents ever need to feel pressured to really to do any of these techniques. Then you have what we would call modified or graduated extinction, which involves the same idea where you put an infant to sleep awake and then don't tend to them or have them put themselves to sleep. But if the infant is awake and crying, the parent would go in and check on them. Just kind of a brief check, just kind of a pat, it's okay, and then leaving the room. And in some cases, this can help infants settle. In other cases, it actually can make it harder because the infant sees the parent there, but the parent isn't picking them up, and that can get the infant upset. So, but that approach works really well for some people. There's also a lot of gradual or gentler methods where the parent stays in the room until the child is asleep, so providing comfort but not necessarily picking them up. So, for example, patting them, just standing by the crib, and then slowly moving closer to the door and then out of the room. And so that can work for some children. That there's less evidence for that approach, but I have seen it work clinically, and there have been a few studies that have looked at that. It does tend to take longer, so we're talking maybe 4 or 6 weeks, rather than some of the other strategies that typically will resolve within a week. So, and then again, like I said, it's also not intervening is also an option. So I don't think parents should feel obligated to sleep train if it's not aligned with their sort of goals and values.
Yeah.
And I mean, there really is no evidence to suggest that the crying is harmful, right? Because it's short term. If as a parent you're responding to an infant's cries and meeting their needs throughout the day, and there's just this isolated time when you are leaving them to self-soothe, there's absolutely no evidence that that's harmful in the short term or in the long term. And there have actually been studies that have even looked at cortisol levels, so stress hormones during the sleep training protocol, and found that even the next day, there are no increases in cortisol, no changes in attachment. So it's really, really just a matter, I think, of personal choice.
Yeah. Talking through that with you, I mean, there really is that spectrum.
Oh, yeah, absolutely.
But I really love your approach, and I think I ascribe to that too, because I think the biggest thing is whatever approach a family decides, the biggest factor of success is just consistency. So whatever they feel like they can kind of do and maintain, that's going to be the better predictor of success, even though it might take 3 days or 4 to 6 weeks, as you said, but kind of going in with their eyes wide open and sort of knowing, okay, well, it feels better to me to be able to do X, Y, Z, and
Right.
that's okay, right?
Yeah.
But I like also that you mentioned that, there's no evidence like that it's harmful. It's just hard though, as a mom, and if you're nursing and you're like having all those responses, you're hearing your baby cry,
Yeah.
it can be hard. It can be hard. So acknowledging that, but that is I think the biggest infancy behavioral issue that comes up, so to speak. I know that you were doing some help in that arena too, especially with your work before, with safe sleep and all of that,
Mhm.
and kind of monitoring how families are doing. So I really love that we kind of talk through that whole spectrum.
Yeah. Yeah,
So,
just
oh,
to
go
add
ahead.
one more thing before we move on,
Yeah.
I would say too that you do want to think about. So when a baby is 6 months, they can typically go 5-6 hours without feeding, and sometimes longer. But if you ever are concerned about either the baby getting hungry, or if you're concerned about sort of nursing and supply, you can still feed a baby during a sleep training protocol. The difference is that you wake them to feed them, rather than feeding them when they wake and cry, if that makes sense. So
Yeah.
they're still learning to self-soothe and put themselves to sleep, but it does not mean that you can't give them a bottle or nurse them. So,
Yeah, no, thank you. That's a really important distinction that you just brought up
we
there.
don't want hungry babies. It's just
Yeah, no, we don't. And we want them to be thriving and healthy and all of that too. So meeting their needs. So that's always number one. But I think what you're talking about is helping your child. The understanding with sleep training is helping your child start to self-soothe.
yes,
So that way, as parents, we're not necessarily needing to always sort of intervene and do that for them.
right.
Yeah. All right. Well, so that was awesome. Thank you for that. So let's jump to the toddlers. Uh, I can kind of come up with a couple
Yeah.
scenarios, but what's your top issue that you see families coming in?
I mean, I think bedtime resistance is a big issue in toddlers and preschoolers. So just not wanting to go to bed, not staying in bed, especially when you get into that crib to toddler bed transition, and or when you have a kiddo who is a good climber and can get out of their crib, that can be very challenging. So we work a lot with in our clinic. We work a lot with sleep routines and having kind of a bedtime routine that encourages positive parent-child interaction and sort of limits conflict. So, for example, if you're getting a young child ready for bed and they have a really hard time transitioning, say, from playing to the first step of the routine, can you make the first step of the routine enjoyable so it's an easier transition? Can you have them go upstairs to get ready for bed by doing a little hide and seek, like having them go up and hide and you find them? Or could you sort of do a silly game going up the stairs or going into the sleeping area? So if there's a step in the bedtime routine that they hate, say brushing teeth or taking a bath, can you move that out of the routine? So really sort of thinking through where are the problems in the routine, and a great way to address those is to try to have a preferred activity follow a non-preferred activity. So to be strategic about that. And then once kids are in bed, there are also some programs that we can sometimes use to help encourage them to stay there. So I have a friend who, the sleep fairy, who is very effective. So essentially, the sleep fairy can be used to reward really any sleep behavior. So you can use it to reward sleeping all night, having a smooth bedtime, staying in bed at bedtime, falling asleep in your own bed instead of in the parent's bed or in the couch. I mean, she can really reward anything. She's very versatile. So, and typically we have kids make a sleep fairy box and put a picture of the fairy on it. And then in the morning, the parent will get down the box and they can look at it and see if the sleep fairy left something for them. So it's a nice way to avoid power struggles, because the parent it really becomes the good guy in this case, right? So the parent can say, well, I really want the sleep fairy to come, right? And so if you want the sleep fairy to come, you have to do X, Y, and Z. So it's not me that is asking you to do this. And so you can't really define me because I'm on your team. I want the fairy to come too. So it can sort of help with that parent-child dynamic. But of course, the child does have to be old enough to understand that cause and effect. So we're not talking about 1-year-olds, or sometimes it can be even hard for 2-year-olds. So there are a lot of programs that can be helpful. That's just one example. Another thing that is important to consider is when kids are transitioning out of their nap. They may not be tired at their bedtime every night, and that can cause a lot of issues, right? Because if you're used to going to bed at 10 as an adult, and I ask you to go to bed at 8 and you're not ready for bed, that's going to be pretty unpleasant.
Yeah.
You're not going to want to stay there. And so sometimes what can happen with kids is, especially as they're transitioning out of a nap, and some days they're napping and some days they're not napping, it can be really helpful to put them to bed later on days that they nap, or just in general to make sure that the bedtime seems to be a good fit for physiologically when they're ready for sleep. Because it's not fair to ask a young child to lay in bed and do nothing for a long period of time. Or I don't think it's unfair, but it may not be developmentally appropriate.
Right. Well, so kind of following up with that, you mentioned what are some of the cues that indicate children are maybe getting sleepy or ready to kind of naturally get ready for bed? Are there any things that parents can look out for?
Yeah, and I think it's really variable, right? So you have your kids who, when they're tired, are going to look kind of like a tired adult, right? They may rub their eyes, they may sort of start nodding off a little bit, they may slow down from a psychomotor standpoint. But then you have a lot of children who don't necessarily look like a sleepy adult. And sometimes they can get extremely hyper, for example, at time, or extremely irritable. Generally, though, you would expect a child to look to seem like the same kid in the evening that they do earlier in the day. Like, we don't change our personalities that much throughout the day. And if you do see that sort of really different personality, then you have to wonder if the child isn't tired because they're ready for sleep, or because they didn't get enough sleep the night before, or because they didn't take a nap that day and they probably still need it. So yeah, I mean, it can really be anything, but I would say the most common are sleepiness, being very hyperactive or wired, and then just irritability and emotionality.
Yeah. So it's good to sort of remind parents who are watching this is to really sort of just watch and observe their child for some cues. It could be nonverbals, it could just be kind of their behavior, what they're saying and how they're acting. But I like what you said. I mean, typically kids' behaviors shouldn't be like drastically different. So yeah. Is there, that like that second wind phenomenon or getting like super hyper can happen? So, any words to parents, like once you kind of find that sweet spot, like, uh, when do you counsel families then to start that bedtime routine?
I mean, it depends on how long your routine takes. It depends on if it's a bath night or not. But generally, you want to start the routine, maybe 15 to 30 minutes before you feel like your child is going to be ready for sleep. Because I think if you start the routine too late, and you have a cranky, irritable, or hyper child, the routine's not going to go as well. If you start it too early, you're going to finish and then put a child to bed who's not ready for bed. And that can be hard. And I will say, too, when you have a kid who's transitioning out of a nap, I do recommend changing the bedtime night to night. Parents often get this message, like, you have consistency, consistent routine, consistent bedtime. And most of the time, that's a good idea, except in situations where kids some days are getting daytime sleep and some days they're not. Then it doesn't as well.
Yeah, no, I really love that you mentioned that. May I just bring up one other point before we move on?
Sure.
Daylight savings time. That is always like this curse. Like some parents are just like, oh no, it's gonna be horrible for the next 2 weeks. Like, do you have any suggestions or recommendations for families who know that their kids are super sensitive to this anticipation? Because it's always kind of this filled with dread thing.
Yeah. I mean, I think if you, I mean, and a lot of kids do okay with daylight savings, and it doesn't seem to be a major trigger. But if you do have a child who struggles with that transition, you can try to shift maybe 4 days in advance at a rate of 15 minutes per day, just so it's a little bit of a slower shift, and so that they're not having that one night where they're just not getting enough sleep, where they're losing an hour of sleep.
Right. No, and I love that. And so 4 days, shifting 15 minutes a little bit earlier, or, however, later, depending on what's happening.
And I would say that there are some guidelines. So the American Academy of Sleep Medicine, for example, has guidelines indicating that daylight savings actually, from a public health standpoint, is not a very good idea. So, not much we can do about that as parents right now, but that's something to keep an eye on, is sort of this policy intervention of potentially doing away with daylight saving.
Yeah, I think there are some families watching this and being like, "Hallelujah, that would be amazing." You know? So our next age group, because is like school age, and then we'll finish up with teens. So, any thoughts or words of wisdom there, thinking about your clinical experience and some of the big issues?
Yeah. I mean, I think in school age kids, you have fears in preschoolers, but I do think that fears can be more acute in that older age group. And I think too, sometimes, anxiety or identified worries where you have a child who can tell you, I'm worried about this, I'm scared about that. That can make it harder to fall asleep. And then I would say also independent sleep. So this is an age where kids, even those who slept very well independently as an infant or toddler, may get scared or have bad dreams and want to start sleeping with a parent again.
Yeah.
And I will say that for children ages 1 and above, there's not really any strong science to say that it's bad for your child to sleep with you. So a lot of times parents come to me and say, get this child out of my bed. This is causing problems for me, for them. And in that case, the gradual wean protocols to sort of slowly move them out of bed can be very helpful. But I do just want to be clear that there's not really science that suggests that your child shouldn't sleep with you, that it's inherently harmful. So if you as a parent feel like you don't sleep as well, or say a parent, you as a parent have to wake up at 5 and your child wakes up, whereas if your child were in their bed, maybe they would sleep until 6 or 7, then yeah, it's a problem. But it doesn't have to be. Again, I think it's a family preference and value matter.
Can we talk quickly just maybe about night terrors? That's an issue that comes up a lot, and it can be really scary to a parent who's observing this for the first time. Can you maybe kind of talk us through what a night terror is and appropriate behavioral interventions?
Sure. Yeah. So night terrors are actually now called sleep terrors, which is a small distinction, but because they don't have to happen at night, they can happen during naps, for example. But sleep terrors are a parasomnia where children will often scream in their sleep. They will seem inconsolable, so a parent is trying to comfort them, and they're not responding to the parent. So usually a lot of screaming, crying, flailing, and a really key component of that is they're not responsive to a parent. So it's not just that the parent can't calm them down, it's that they literally don't know that that person in the room is their parent. There's not that recognition. It tends to peak actually in the preschool years, but does extend into school-aged years. It's pretty rare in teenagers. Puberty tends to be a turning point. And the child looks awake. Often their eyes are open, not always. But I think the key thing for parents to know is that the child is asleep. And not only are they asleep, but they are deeply asleep. They're in what we call slow wave sleep, or kind of the deepest, most restorative form of sleep. And so no one else in the house is getting any sleep, but this child is sleeping well. So it's not necessarily going to cause issues for the child the next day because it counts as sleep. And so part of the approach to when families experience this is just to reassure the parent. This is just a phenomenon that happens to some kids and not others. It's actually more similar to sleepwalking, which is another parasomnia, than it is to, say, nightmares or emotional difficulties. It's not thought to be related to strong emotions or seeing scary things. It's really just something that some kids do and some don't. It is a strong genetic component. So a lot of times kids who have sleep terrors, there's someone else in the family who has had sleep terrors or is sleepwalking. And really the main intervention is to try to make sure the child is getting enough sleep. Because if they are sleep deprived, either temporarily, right, because there was a sleepover or a family trip, or chronically because they're not getting the sleep that they need for other reasons, they will have more of these types of episodes. So parents can really minimize them by paying attention to their child's sleep duration.
Okay. Yeah, because I've often gotten some reports from families saying, if their child is having a sleep terror, sometimes they can cluster, like, and then they go away, right?
Mm-hmm.
Is that typical of what you see in these, or could it just be random, depending on what's happening with the child's sleep?
I mean, I do think that um, they do tend to be. I mean, sleep deprivation is such a big trigger that you will see more. You do tend to see the episodes, like you say, clustering or in conjunction.
Mm-hmm.
There are other triggers too that can cause events to occur when for example, maybe a child hasn't had an event for a couple of weeks and then they start having sleep terrors again. Physical illness, a bladder infection, environmental disruption. So maybe, another person going into the room that wakes them up. So essentially anything that's internal to their body or external that disrupts sleep can trigger an episode in kids who are prone to them.
Yeah.
A lot of kids will never have them, but in kids who are genetically prone, there are a lot of things that can trigger an episode. So,
Okay. Well, and we are getting on time here, but I do want to make sure we address the adolescents really
yes,
quickly. So
yes.
let's think through what's like one of your main, concerns that parents come to you when they have a parent or a child who's an adolescent.
I mean, insufficient sleep is by far the biggest issue, or the most common issue in adolescence. And, there are a lot of reasons why it's really hard for teens to get enough sleep. One is they have a natural circadian delay. So a lot of teens are not necessarily going to be tired until on average between 11 and 12. And a good natural wake time for them tends to be between 8 and 9. And so when they are having to wake early to attend school, it's going to be hard to get enough sleep because if they try to go to bed earlier, 9 or 10, a lot of times their systems aren't ready for sleep. And so that can be really challenging. And then of course, just all the responsibilities and the stress that a lot of teens are trying to manage if they're finishing homework, the ubiquitousness of screens and screen use and being on screens to interact with friends, fear of missing out. So there are a lot of factors. One thing we do know is that parental limit setting is protective. And so regardless of all these issues that may be stacked against your kid or all these issues that are causing them to not get enough sleep, having a parent who has screen time limits and tries to enforce a set bedtime really is protective. Yeah.
Well, I can imagine some of the parents watching saying, thank you, thank you, thank you for saying that and validating the need that I have to put those limits in place. They are meant to be helping
Right.
and not necessarily being the mean parents, right? I mean, this is really helping them learn these healthy habits, right? And so a
And
lot of
I think also to sort of stand your ground as a parent and know that it helps
yes.
To have some limits, but also the deck really is stacked against kids around getting enough sleep. And so to also have some empathy and to validate your child's experience. Like, I know that it's probably hard for you to fall asleep at 10. I know that all your friends are probably awake.
Yeah.
And that's real and that's their experience and that's hard. So so I would just add that.
Yeah, I love that. And you mentioned, not all the schools, but the American Academy of Pediatrics. I'm sure the Academy of Sleep Medicine also with the later start times for adolescents and really advocating for that,
Mhm.
given their natural shift in the circadian rhythm. But if your child attends a school district that they haven't adopted that policy, it's really challenging. Um, because we're fighting against biology,
Right.
physiology, what's
You're right.
happening. Yeah.
We are, and I think it's also important to know that this normative circadian phase delay that happens around adolescence, where
Mhm.
kids aren't tired until later and they're not really alert until later in the morning, it does happen in most mammals.
Mhm.
And so while there clearly are cultural factors that contribute, so screen use and homework, and sometimes just not wanting to go to bed. I mean, I don't want to go to bed sometimes. So clearly there are cultural factors, but um, in addition to that, this change is really physiologically driven. So
Mhm.
it is something that's hard for teens.
Yeah. Yeah. So, I mean, obviously there's some other factors to consider, but I think what your point is, empathizing with your child and then also, remembering you can put limits in place too and not
Mhm.
feel so guilty about it because as a parent, we need to do that. But
Yeah,
there is a reason, and it's not just your child's trying to be oppositional.
yeah.
So, yeah, no, that's great. So we talked a lot about a lot of just like I feel like we got a huge freebie here getting to talk to you about like some of these like top concerns based on ages. So thank you. My gosh, this is such an awesome episode. Now, if people are like, "Oh my gosh, where can I go to learn
Mhm.
more?" Can you share some of your favorite resources with us? And I'll make sure to put whatever you share in the show notes so that people can quick link and click on that.
Yeah. So, babysleep.com
Uh-huh.
is a great website. It's free for parents, and it was developed by sleep experts with the goal of just providing some evidence based sleep recommendations for kids
Hmm.
from birth to 3. There's some nice content for kids who have neurodevelopmental difficulties as well. So that's a really nice site. Uh, Craig Canapari has a nice blog. Dr. Canapari is a sleep medicine physician at Yale, and he focuses on sort of sleep issues. So I would encourage you to check out his blog. And
Hmm.
in addition, of course, to Let's Talk Kids Health, which has a lot of good sleep content. And then for sleep apnea, the the American Association for Sleep Apnea, sleepapnea.org, that
Hmm.
also has some nice resources for parents who are wondering if their child could have sleep apnea.
Great. And we'll make sure to put all those in the show notes. So again, I really value your expertise, your time, sharing your wisdom with the people watching this. When I first thought about doing this show, I thought, wouldn't it be great to just sort of get out this information to as many families as possible? Because especially given the pandemic and the times that we're living in, there's so many struggles and if we can even just work on sleep, because that is probably one of the biggest protective factors against behavior and mental health issues, is making sure that we're all doing what we can to help protect our sleep is so important. So thank you. This is such
Yeah,
a good
thank you.
topic.
Thank
And I really enjoyed our conversation. So just to wrap up and let you guys know, those who are watching, happy Thanksgiving, by the way, because this is going to air on Thanksgiving. So I hope everyone's enjoying. And we talk about after eating some turkey, the big tryptophan and like getting really sleepy,
you.
right? But so for those of you watching, if you do have questions or comments, like I said, I'll be monitoring as I can. But hopefully you're all enjoying the holidays. I do want to let you know that my guests for the following week are some of my really good friends, Diane Pike and Sandy Bryant from St. Mary's Child Center here in Indianapolis. They're going to be talking about the importance of high quality early childhood education. So please tune into that special episode on Thursday. It'll be our first one in December. Also, if you have any questions or topics or guests that you'd love to suggest, contact me directly at Dr. Narissa at letstalkkidshealth.org or just follow my YouTube channel, Facebook, and Instagram and send me a message there because I'm always checking those platforms. And then I do want to let you know that even though we're at the end of the month, my November book club pick, Driven to Distraction by Dr. Edward Hallowell, is still going. And just to remind you, for those of you who are reading along this book club, Dr. Hollowell has graciously agreed to do a book club chat with us mid December. So there's still time to pick up the book, get it from the library, get it on Audible, listen, read it, and then join that conversation. It's a once in a lifetime opportunity to be able to talk to the author and sort of just pick his brain a little bit. So it's a great book, and I hope you'll enjoy and join me in the parenting discussion group. So that wraps up this episode. Thank you again so much, Dr. Honaker, for your time, expertise. So great to catch up with you and see your face. Um, and again, don't hesitate to reach out if you have any questions, comments, and share this episode. Thanks again. We'll see you next week.